Hello. Are you suffering from troublesome pain of heel, elbow, or knee joint? What if I tell you that there is a natural solution in which your own blood can heal your damaged tendon, bones, and joints? Hello, I'm Dr. Hiren Patel, Anant Hospital. Let I educate you today regarding a novel and very natural healing technology of platelet-rich plasma, in which your own blood helps in healing the tissues and orthopedic and bone and tendon problems. Uh, I enumerate as below, like tennis elbow, golfer elbow, heel pain, knee pain, and shoulder pain. Let's introduce how platelet-rich plasma works. Platelets are very tiny cells inside our blood. They have a responsibility of releasing platelet-rich plasma factors like platelet-derived growth factor, VEGF, IGF. This factor helps reduce inflammation, helps in tissue repair, and helps in eradicating the disease of tendon and joint from within. So let's elaborate the disease first, and then we will consider the role of PRP. Let's start with heel pain. This is the calcaneum bone. So the plantar fascia is a very thin sheet of fascia beneath the calcaneum bone, and it damages in cases like obesity, overuse, some hormonal problems, and causes very annoying symptom of heel pain, difficulty in walking, especially the first few steps of the morning. Pain can be excruciating and thorn like pinching inside the bone. In this disease, the plantar fascia, thin fascia, gets inflamed and micro tear develops in this fascia. In initial phase of treatment, that is first 2 to 3 months of this disease, the main therapy are rest, orthotics, hot fomentation, and sometimes corticosteroid injection. 9 in 10 people gets relieved by this mode of treatment, but very few people develops chronic plantar fascia pain, that is heel pain. This is where the role of PRP comes, and PRP is indicated in these patients. So how does PRP works? In this novel technique of a treatment, we draw 30 to 40 ml of your blood. We introduce it into centrifuge in a very aseptic environment, and we harvest the plasma from the blood and extract it. Routine blood has a basic concentration of platelet, but the centrifuged plasma which we procure from your blood after processing has 3 to 5 times of platelets, and this rich concentration of platelet we introduce into the diseased area in a sterile aseptic environment, the zone where actually the diseased tendon requires healing. Platelet reaches there and helps in healing of the problematic area. So we discussed regarding the treatment of a heel pain, that is plantar fasciitis, with PRP. Let us now discuss the treatment of tennis elbow with PRP. This is the elbow joint, this is the lateral epicondyle, and the main problematic tendon in tennis elbow is extensor carpi radialis brevis, which starts from the lateral epicondyle of the humerus and is spans the entire forearm and reaches the wrist joint, who are very much culprit from the problem of tennis elbow. Not only the tennis and other athletic players, but women and men who do repetitive movement of arm and forearm at the elbow joint are very much susceptible to involvement of pain in tennis elbow. Here again, as explained in the heel pain, the micro tears develop in extensor carpi radialis brevis. The initial treatment of acute tennis elbow, as similar to the heel pain, is done by NSAID tablets, rest, orthotics, physiotherapy, and sometimes corticosteroid injection. But the basic difference between corticosteroid injection is that it uh, reduces the inflammation but does not help in cure of the disease in such tendinitis, fasciitis, and cartilage swelling. Whereas platelet rich plasma, which is rich in platelets, which has platelet derived growth factors, IGF, TGF, VGEF, all these factors helps in three-stage revival of the diseased tendon. That is, in stage 1 it reduces the inflammation, in stage 2 it reduces the pain and swelling, and in stage 3 it does the actual repair of the damaged tissue. So it is basically a type of orthopedic cure of such stubborn orthopedic problems. Now let's study the role of PRP in golfer's elbow. Like similar to tennis elbow, when the medial side of the elbow joint is involved in the pain, it is called the golfer's elbow, because the common flexors of the forearm gets originated from this medial condyle and epicondyle, and it spans the forearm and reaches up to the wrist joint. So in golfer's elbow, the origin of these common flexor muscles develops inflammation, develops microtrauma. As explained earlier, early cases can be treated very well with rest, NSAID, physiotherapy. But in advanced cases of chronic golfer's elbow, where all the non-operative treatment have failed, patient wants relief, then we do inject PRP in medial epicondylar region under IITV guidance, under sterile aseptic environment, helps the actual healing of the damaged zone of medial epicondylitis. So this was the role of platelet-rich plasma in golfer's elbow. Now let's again discuss one common heel problem, that is the Achilles tendinitis, which we call as the Achilles pain or Achilles tendon pain. Here I have shown the calcaneum, it is the heel bone. This is the posterior pointing process of the heel bone where actual tendo Achilles is inserted. In some people, this bone becomes pointed and a horn-like structure gets developed, which we call it as a Hageland deformity. So what this pointed structure causes the trouble is that whenever Achilles tendon is attached at this point and we have frequent movement at this tendon bone junction, especially during walking, running, climbing the stairs up, descending the stairs down, because in any calf movement the gastrosoleus muscle contraction requires movement of Achilles tendon, and hence there is a forceful impaction at the tendon bone junction. So this is the main principle of development of heel pain in Achilles tendon. It is called Achilles tendinitis or Hageland deformity. Person have symptoms like heel pain, heel swelling, difficulty in walking, cannot wear the tight footwear. So in acute conditions, the mode of treatment are rest, NSAID, and corticosteroid injection in some cases. But here the trouble is corticosteroid injection has a very drastic and very difficult complication of a tendon rupture of Achilles tendon. But here is the role of PRP in Achilles tendinitis, where it reduces the inflammation naturally, It helps in reducing the swelling and pain of the person, and actual healing of the micro tears of the tendon Achilles happens after the PRP reaches the problematic area, and helps in relieving the trouble by a very natural and curative way. Now we discuss the role of PRP in knee cartilage pain. I explain you one medical condition of knee pain which is called chondromalacia patella. I show here the natural femur joint and the knee patella cap bone. So whenever there is a swelling in the cartilage in the knee patella cap, which I have shown here, this is the under surface of patella. Whenever the cartilage gets swollen, the swollen cartilage rubs against the distal end of the thigh bone, which helps in developing the symptoms like knee pain, especially in sitting cross leg, sitting down, and in stairs climbing and stairs descending. This swollen cartilage causes severe pain, disability, not able to perform the day-to-day activities. It is a very clinical diagnosis. Upon history and physical examination by a clinician, we diagnose it very regularly. The condition is called chondromalacia patella. In acute cases, again, the treatment of choice is rest, NSAID, and physiotherapy. Whenever there is chronic chondromalacia patella which does not respond to the acute treatment as explained above, again the role of PRP is there. We inject PRP in a sterile environment in the knee joint, helps reduce inflammation, pain, and curing of the swelling of the cartilage, that is chondromalacia patella. So now I explain in detail who are the candidates for platelet-rich plasma. Any person who has chronic pain in heel, chronic pain in inner or outer side of elbow joint, chronic pain in the posterior part of the heel, that is Achilles tendon area, or a chronic pain in the knee joint where there is not advanced arthritis, they are very good candidates of platelet-rich plasma. Those who have not responded to other treatments like painkiller, rest, physiotherapy, orthotics, or corticosteroid injections. Even in failure of corticosteroid injections, PRP injection works very well. It is a very novel technique. It helps healing of the inflamed zone in a very natural way, as I have explained previously. In which people it is contraindicated, that is, in which people it cannot be given. It cannot be given in a person who has local infection in bone, joint, or tendon. It is contraindicated in a person having a blood dyscrasia, that is a bleeding problem, or a problem where bleeding does not stop. It also cannot be given in chronic arthritis of the joint, where already the cartilage is damaged and there is advanced bone destruction and joint problem. It cannot be given. It is a very daycare procedure. It requires only 30 to 45 minutes of time, which includes drawing of the blood of patient, processing under the centrifuge, retrieving it in a sterile environment, and injecting in a aseptic precaution to the diseased bone and joint. What patient can expect in initial 48 to 72 hours is that sometimes it causes flare of symptoms, that is increase in pain, swelling, and difficulty in walking. That is very natural because the body has started the healing response, and it is visible clinically also. The partial reduction in symptoms and improvement is visible at 4 to 6 weeks. A complete recovery is visible in 3 to 4 months, and some research, that is some journals like Journal of Foot and Ankle, has shown a single shot injection of PRP is far better than I in local corticosteroid injection or NSAID or hot fomentation in relieving of the symptoms of chronic tendinitis and keep it relieved for at least 12 to 24 months. Even the research journals have shown this benefit. It is a daycare procedure. It is a very safe procedure, also safe in patients of diabetics and low immunity people where other conventional treatment has high risk of infection. So this is very safe procedure, and we have explained platelet-rich plasma in detail in common orthopedic problems. So do watch our videos. You may also give comments or subscribe us on our YouTube channel, because we definitely and on regular aspect educate people regarding their orthopedic problems. Thank you very much, Dr. Hiren Patel, Anant Hospital. Thank you.